Hey guys, my name's Dan. I am a soft tissue pain and injury rehab specialist. In today's video, we are going to be looking at 5 movements to help alleviate the symptoms of non-specific lower back pain. So non-specific lower back pain is one of the most common things that I see and treat on a day-to-day basis. What I mean by non-specific is that you cannot be given a formal diagnosis of there being an actual problem. Your spine, the bones seem to be pretty healthy. The muscles haven't got any obvious tears in them or any issues like that. Likewise with the tendons and ligaments, and there's no compression or issue with the nerves. That doesn't mean you're not in pain. Sometimes non-specific lower back pain can be really quite debilitating. But what's likely to be going on is that lifestyle factors such as sitting, heavy lifting, stuff like that is starting to have an impact on your posture, the way you hold yourself, and it's also starting to cause certain muscles and tissues to become shorter and tighter and others to become longer and weaker, resulting in this almost overuse issue which starts to cause this pain. What we're going to do today is go through 5 movements which are going to help create a little bit more mobility in your joints and start to create a bit of more strength so that you end up with getting some kind of alleviation from the pain itself, but also long term start to resolve some of those issues so that hopefully the pain will ultimately go away for good. So the first exercise, the first movement that we're going to do is a pelvic tilt movement. We're going to do this lying down on the floor or on a yoga mat. So get yourself onto the floor like so, with your feet stacked onto the floor, okay? Keep your bum on the floor as well and your shoulder blades on the floor. Now what you're likely to have at this point is a slight curve in the spine which leaves a little bit of a gap between your back and the floor. You're going to take your hand and you're going to slide it into that gap so that your hand is underneath your spine. I'm actually going to use the other hand and take this one out of the way so you can see what I'm doing for the movement. So I'm putting my hand into that gap below my spine. And all we're going to do is we're going to tilt our pelvis so that we flatten our back and then expand that curve in a nice, slow, controlled movement. So first off, we're going to tuck the tailbone under and flatten the hand down. And then we're going to stick our bum out and increase that curve. Now it's a small, subtle movement that you might not be able to see. When you've got the hang of it and you can feel that you are reducing and increasing that pressure on your hand, take the hand out so you can go all the way down to the floor. Okay, so all the way down, flatten the back down, all the way up, push the bum out and increase that curve. So this is all coming from the pelvis. So what we're doing is we're actually creating movement and mobility in the pelvis, which is something a lot of people lack. Now if you do this and you notice any pain in the back itself, then try and keep that pain below a 2 to 3. If you're struggling to do that, then reduce the range of movement and stay within a pain-free range of movement. So that may mean that you only get a tiny bit of movement initially, but over time you're going to increase that. What I want you to do is aim for 20 to 30 repetitions, and you can do this one sort of 2 to 3 times a week to start getting some movement in that pelvis. So the next movement we're going to do is a deadbug exercise, and this is one of my favourite exercises for strengthening up the muscles of the core. Now, a weaker core can often be the result of your lower back having to do more work to stabilise the spine, meaning that you're then likely to start getting pain in the lower back. So we're going to come into the same sort of position that we were in the last exercise. We're going to bring our arms up over our chest like so. And then you're going to take your feet off the floor so that your knees are stacked above the hips. Now, if the actual exercise itself is quite challenging, then just instead of doing the exercise, just hold this position and focus on keeping that lower back squashed into the floor. Doing that alone is going to create a slight contraction in here and start to strengthen that up. So if you struggle with the exercise, just do that and that will help strengthen up the core. If, however, this position feels okay, we'll start trying the exercise. And this is a really difficult one to get right because you have to concentrate. So what we're going to do is we're going to extend out the opposite arm and leg at the same time, like so. What you'll notice is as I do it, the ones that aren't moving are staying stable in the middle. Okay, you have to really concentrate to get this one right, and it's a great way to build both stability and strength in the muscles of the abdomen and the core. Okay, with this one what I recommend is that you work up towards doing 12 to 20 repetitions and do that a couple of times, and again 3 times per week is a great starting point. So the final movement we're going to do lying down is actually a spinal twist, which is a great way to get a little bit of rotation into the spine and actually creates a nice stretch along the muscles that might be sore. So we're going to come back onto our back like so. This time we're going to take our arms out to the side. We're going to bring our knees up over our hips. This is our starting position. From here, what you're going to do is you're going to drop your knees down to one side. Get them as close to the floor as they can, and then just let your feet rest down on the floor. You're then going to take your head over the opposite shoulder, making sure that opposite shoulder stays down and isn't trying to rotate over. Okay? Hold that position for about 30 seconds, then come back into the middle and go down to the other side. Okay, so the most important thing with this one is making sure that you're only going as far as you can up to the point where that shoulder and arm is able to stay on the floor on the opposite side. If that starts to come up, then you're no longer really twisting, okay? So just go as far as you can until that wants to come up, and then just drop the feet down and stay in that position. Okay, again, hold for 30 seconds on each side, and you can do this one 3 to 4 times per week. So next up we're going to steal a yoga move. So to start off with this one, you're going to come into what yoga would call a tabletop position where you're on all fours. So you've got your shoulders, elbows and wrists all stacked above each other, and then you've got your knees stacked below your hips. This is our starting position. Now we're going to do a cat-cow movement. So what we're doing here is, to start off with, we're going to tuck our chin, and as we do it we're going to push our spine up towards the ceiling. And then we're going to reverse it, so we push our belly towards the mat and take our chin up towards the sky. And then repeat, and try and do it as a nice flowing movement, a nice steady pace. Like so. So as you can see, a lot of the movement here again is coming from the pelvis to help create that curve in the lower back. Just like with exercise 1, if you feel any pain with this one, try to keep it below a 2 or 3 on a pain scale. If that's not possible, then just limit the range of motion so you're just working in that pain-free range. Over time, you can slowly start to increase that by just testing to see if that pain gets better as you're able to move a little bit more. Again, I'd recommend doing this one about 20 to 30 times, and do that 3 to 4 times per week. So the final movement that we're going to do is actually a stretch for the hip flexors, which run across the front of the hip here. Now these muscles can be particularly tight in anyone that spends any time sat down, and this can definitely start to cause issues in the back, because when these are really tight they can start to change the position of the spine and also change the position of the pelvis. So we're just going to do some stretching work to lengthen them out. So your starting position here is to bring one foot up in front, start with your knee stacked above the ankle, and then on the other side you're going to have your knee on the floor and that's stacked below your hip. And it's actually the side with the knee on the floor, so in this case for me it's my left side, that we're looking to stretch. Now to start the stretch, you're going to tilt that pelvis by tucking your tailbone under, and straight away you're going to feel, as you do that, a stretch on this leg where the knee is on the floor. When you found that stretch, you're then going to shift your weight forward until that stretch increases. You're then going to hold that for around about 30 seconds. When you've done it on one side, switch over and repeat on the other side. So tuck that tailbone under to start the stretch and shift the weight forward like so. Hold for 30 seconds or so on that side as well. Again, do that one 3 to 4 times per week. Okay, so there we have it. That is 5 great movements to help alleviate the symptoms of non-specific lower back pain and hopefully long-term start to create a bit more mobility and a little bit more strength so you can start to solve that issue long-term. If you do have lower back pain, I highly recommend you see a specialist to get yourself a diagnosis before you dive straight into starting to do some exercises, just to make sure that there isn't anything going on there. Particularly if you have any issues with things like numbness, any things like change of bowel habit or anything like that, you need to see a specialist immediately. Get yourself to a doctor. Now in this video I've suggested that you work for about 2 to 3 to 4 times per week, and I've given you a specific amount of targets in terms of how long to stretch for and how many repetitions to aim for. Obviously that is just a guide, everyone is different. If you're so busy that all you can manage is just one round of all of those exercises and movements per week, then start with that. Okay, don't put yourself off because you feel you haven't got time. If you're really limited on time, then just pick one of those movements and do it one day, and pick another movement and do it another day. Doing something is going to be better than doing nothing. Don't try to aim for perfection, just try and aim for getting something done. I hope this helps, guys. If you like the video, please give it a like at the bottom, and if you've not yet done so, remember to subscribe to the channel, and I'll see you in the next one.